All right, let's jump right into this explainer. Today, we're basically stepping into the shoes of a medical detective to unravel a totally fascinating, obscure, and frankly, potentially life-threatening condition. We're going to explore a hidden biological failure that can easily masquerade as completely unrelated diseases. This is a journey through a medical mystery that's going to teach us some absolutely vital clues about how our bodies handle stress and how missing just one tiny chemical can literally bring the entire human machine to a crashing halt.
Okay, let's dive into this with a really compelling real-life case we pulled from our source material. Imagine this, a 27-year-old guy named Ahmed. Over the course of 2 whole years, Ahmed visited 18 different doctors, general practitioners, specialists, you name it, and yet not a single one of them could figure out what was destroying his health. He eventually landed in a doctor's office in a totally acute state, absolutely convinced he was suffering from some severe abdominal emergency. I mean, how does a modern medical system miss a diagnosis 18 times in a row?
Well, to understand why, just look at this list of Ahmed's incredibly bizarre and confusing symptoms. He'd lost 14 kilograms, that's about 30 pounds. He was suffering from this intense, crushing fatigue, known medically as asthenia, which actually got progressively worse as the day went on. When things got really bad, he experienced acute abdominal pain and vomiting, which, perfectly mimics a surgical emergency or a severe GI bug. But there was one more symptom, a really peculiar one. His skin was actually changing color. He was getting darker despite not spending any extra time out in the sun. Section 1. The Anatomy of a Crisis. To solve Ahmed's mystery, we've got to travel deep inside his endocrine system. The culprit here is a condition called adrenal insufficiency. This happens when your adrenal glands, those two little triangular hats sitting right on top of your kidneys, they simply stop working. They fail to produce essential hormones. The two heavy hitters we really care about here are glucocorticoids, primarily cortisol, and mineral corticoids, primarily aldosterone. Without these, your body essentially just forgets how to regulate its most basic survival functions. Let's focus on cortisol for a second. Our sources highlight this brilliant little mnemonic used by French medical students, coined by Dr. Astuce to remember exactly what cortisol does. They break the word cortisol into cortisol, which translates to heart isolates. It sounds a bit poetic, right? But it perfectly captures the biological function of this absolutely vital hormone. So here's how that mnemonic breaks down in practice. Core, or heart, reminds us that cortisol provides crucial cardiovascular support. It keeps your blood vessels primed and your blood pressure totally stable. Isol, or isolates, reminds us that cortisol isolates you from the heat, meaning it regulates your temperature and prevents fever. And finally, cortisol is a stress hormone that actually elevates your blood sugar to give you energy. So think about it. If your adrenal glands fail and cortisol disappears, the exact opposite happens. Your blood pressure crashes, you develop a fever, and your blood sugar just plummets into hypoglycemia. Section 2. Spotting the symptoms. Now, what's really interesting about this is knowing all that, the intense fatigue and the crashing blood pressure totally make sense. But what about Ahmed's changing skin color? Well, the ultimate clue those 18 doctors missed is called melanoma. It's an abnormal hyperpigmentation, or darkening, of the skin. But it doesn't look like a normal tan. It specifically targets the palmar creases of your hands, your old scars, and even your gums, creating these dark slate gray patches. Why does this happen? Well, when your adrenal glands stop making cortisol, your brain basically panics. The pituitary gland in your brain starts pumping out massive amounts of a signal hormone called ACTH, screaming at the adrenal glands to wake up. And the chemical precursor to ACTH just so happens to contain melanin-stimulating properties. So this massive hormone surge literally dyes the patient's skin dark. This was the massive red flag waving right in front of everyone's faces. Section 3. Primary versus central causes. But why did Ahmed's adrenal glands stop working in the first place? And this brilliantly illustrates how adrenal insufficiency actually comes in two distinct flavors. On the one side, we have primary adrenal insufficiency, which is also known as Addison's disease. This is when the adrenal glands themselves are physically destroyed. Because the glands are dead, the brain pumps out high levels of ACTH, causing that dark melanoma. Plus, because the whole gland is gone, you lose both cortisol and aldosterone. On the other side, we have central adrenal insufficiency. Here, the adrenal glands are perfectly fine, but the pituitary gland in the brain is malfunctioning, and it forgets to send the ACTH signal. Because ACTH is low, there is absolutely no skin darkening. Plus, in the central type, the aldosterone production remains largely intact. Because Ahmed had dark skin and gums, we know for a fact he had the primary type. So what actually physically destroys the adrenal glands in these primary cases? Well, most commonly, it's an autoimmune disease where the body's own immune system attacks the glands. But in many parts of the world, tuberculosis is actually still a massive culprit, leaving behind these calcified ruins of the adrenal tissue. Other causes can include severe bilateral bleeding, blood clots, or even metastatic cancers spreading from places like the lungs or breast.
But what about the central type? Believe it or not, the most common cause here is actually medical treatment. Yep, if a patient takes synthetic corticosteroids for a long period, say for severe asthma or rheumatoid arthritis, the brain basically says, hey, we have plenty of cortisol, I can take a vacation. The brain's natural production just goes to sleep. If the patient suddenly stops taking their medication without tapering off, the brain doesn't wake up in time, causing central adrenal insufficiency. Other causes for this type include pituitary tumors or bleeding in the brain.
Section 4. The acute crisis. A life or death emergency.
When this condition goes undiagnosed for too long, that slow burn of chronic fatigue suddenly erupts into an acute crisis. This is exactly how IMED ended up in the hospital. I mean, an acute crisis is literally a life or death biological meltdown. Without aldosterone to manage salts, the patient's sodium levels plummet, leading to severe dehydration and confusion. At the same time, their potassium levels spike to toxic heights, which can trigger lethal heart rhythms. You'd actually see this on an EKG as sharp peaked T waves. And without cortisol, their blood sugar drops into dangerous hypoglycemia. The patient goes into severe shock. And here's the kicker. Standard blood pressure medications simply will not work without cortisol already in the system. At this exact moment, time is the ultimate enemy. If a doctor sees a patient in unexplained shock with a fever, abdominal pain, and skin pigmentation, treatment must begin instantly. Waiting until the next morning to run a standard cortisol lab test could literally kill the patient. The medical team has to draw blood for later testing, but immediately inject intravenous hydrocortisone and pump the patient full of saline and glucose. You act first, and you confirm later.
Section 5. Diagnosing the deficiency. Let's move to and see how this builds when a patient isn't actively in an emergency.
So how do endocrinologists actually prove this disease exists when things are stable? The diagnostic journey is highly structured. First up, they measure basal cortisol at 8 a.m., which is when levels naturally peak in a healthy person. If that level is exceptionally low, like below 5 micrograms, the diagnosis is confirmed right then and there. If the result is in a gray area, doctors use what's called a synacthin test. They inject synthetic ACTH to artificially stimulate the glands. If the cortisol levels don't shoot up in response, it proves the adrenal glands are broken. And if they suspect a central brain issue, they might cautiously use an insulin test to lower blood sugar, basically forcing the brain to react to the stress.
Section 6. Life-saving treatments and management. Fortunately for IMED, once he was pumped full of hydrocortisone, he went from death's door to feeling totally normal within 24 hours. But of course, the glands don't grow back. These patients survive through precise daily management. They have to take hydrocortisone tablets every single day, usually split into 2 or 3 doses just to mimic the body's natural morning peak and evening dip. For primary cases like IMED, they also need fludrocortisone to replace the missing aldosterone. And here's a really fascinating twist. While most of the modern world is told to eat way less salt to protect their hearts, these patients actually need a normal or even high salt diet to survive. Never adopt a salt-free diet. Finally, they absolutely must carry a medical alert card at all times because emergency responders need to know their vital secret if they're ever found unconscious.
But our bodies aren't static, right? Think about it. Our natural adrenal glands constantly adjust our hormone output based on what we're actively doing. So what happens when a patient relying on a fixed pill dose gets the flu, requires dental surgery, or experiences a severe emotional trauma? So the crucial point is that they have to become their own endocrinologists. Because their missing glands cannot automatically react to stress by releasing extra cortisol, the patient has to manually increase their dose. If they get a fever, an infection, or undergo extreme stress, they're taught to immediately double or even triple their daily hydrocortisone intake. If they start vomiting and can't keep the pills down, they must inject themselves with an emergency hydrocortisone shot and head straight to the hospital. Failing to do this will throw them right back into a lethal acute crisis.
As the medical experts in our sources firmly emphasize, just writing a prescription is nowhere near enough. Empowering the patient with deep, practical knowledge about their own disease is the ultimate life-saving measure here. An educated patient knows exactly how to read their body's signals, adjust their medication safely, and avoid the emergency room entirely.
Imad suffered for 2 long years because 18 different professionals looked at his symptoms in total isolation, rather than seeing the interconnected biological system crying out for a single missing hormone. It really forces us to ask a profound question. Could someone in your life right now be suffering from unexplained weight loss, intense fatigue, or oddly darkening skin, just waiting for someone to finally connect the dots? Well, now that you know the clues, you might just be the detective they need.